Okay, so we're in our second study into individual differences approach, and we're looking at Rosenhan study, Being Sane in Insane Places, 1973. Now, there's some new keywords to do with this study, and those keywords are pseudo-patients. Now, these are fake patients, people who pretend to be poorly when they're not real, and these are our pseudo-confederates in the experiment. The DSM is the Diagnostic Statistical Manual used in America for mental disorders. A type 1 error is where we overdiagnose somebody, and a type 2 error is where you underdiagnose somebody, for example, with a mental condition such as schizophrenia. De-individualization or depersonalization is not treating somebody as a person, but treating them as an object within the hospital, for example. So the aim is to test the reliability of the DSM. So it's less about diagnosing somebody with schizophrenia, but it's more about the tool that's used to diagnose someone as sane or insane, in this case with schizophrenia. So it's looking for consistency of diagnosis with using the DSM. And by doing the reliability, really you're testing the validity as well. Is it fit for purpose? So the issue of the study is not diagnosis of mental illness itself, not schizophrenia, but more about the DSM, the tool that's being used. Now, the method that Rosenhan adopts is a field experiment. He's looking for differences in diagnosis out in the field. So he's going to go out to real hospitals within America to see if he can get his confederates, his pseudo-patients, admitted into hospital. Once they're in there, they're going to do unstructured observation. Now, in the study, you've got 3 females, 5 males, so that's 8 participants, pseudo-patients in total. The participants are actually the hospital. Now, they're going to try and get into 12 different hospitals, and they're going to ring up the pseudo-patients, they're going to ring up the hospitals and ask for an appointment. Now, when they get to the appointment, when they're accepted for an appointment at one of the 12 hospitals, the rest of the procedure is then standardized. So the participants arrive at the hospital and say that they are hearing voices in their head. These voices are unclear, but they appear to be saying thud, hollow and empty. The person appears in a bit of a depressed state, really. When asked about the rest of what's happening in their life, who they are, apart from the empty, hollow thud, everything else in their lives is reported as a normal life. So they're living a normal life. Now, the pseudo-patient's job is to stay in the hospital until they are discharged. So they can't go in there and say, okay, it was all a bit of a ruse, let me out now. What they have to do is they have to act normally and wait to be released from the hospital. Okay, so that's the end of Pearl 1 for Rosenhan.